Thank you so much, Dr. Marin, and the organizing committee for inviting me to join this virtual conference. It's indeed a pleasure. And I've been given the topic that is very close to my heart, something that I've been doing for the past 20 years or so. So I'll be sharing the screen now, and then I'll be talking on the Pharmacists Against Tobacco, the Malaysian Experience, focusing in on the training program that we do for pharmacists. It's a certification program. But before that, I have a disclosure that I have actually received financial support from pharmaceutical companies for speaking engagement and teleconferences and meetings. And I will not discuss off-label use or any investigational use in my presentation. So as I mentioned earlier, this presentation is going to discuss a certification program for Malaysian pharmacists as smoking cessation service providers. As we all know, the health providers have a role in tobacco use disorder, and one of the methods that had been identified is the 5 A's method. The 5 A's stand for, the first A is asking about tobacco use, and then you will classify their tobacco use disorder accordingly, whether they are using only cigarettes, for example, from tobacco, or also other products, for example, electronic cigarettes and other heated tobacco products. They may also be exposed to tobacco smoke from other people, and they are non-smokers themselves. So we need to ask in order to identify. And the way that you ask, it has to be respectful, but at the same time, we can use our roles as healthcare providers in association with their illness or diseases that they have in order to identify the tobacco use. Once we identify that the person is a tobacco user, we need to advise the person to quit. We can use clear, strong, positive, and personalized manner. For example, saying that quitting smoking is the most important thing that can be done for your health, to control your blood pressure, to maintain your blood sugar control, anything that relates to the patient's illness. Or even you can talk about prevention, for example, protection from heart disease, cancers, COPD, and other illnesses associated with tobacco use. So this advice can also be made personalized according to patient's interest or your knowledge about the patient. After you have asked and advised, you need to assess, which is the third A in the 5A strategy. Assessment would include, one is the willingness to make a quit attempt. That will give us a different category of patients. For example, the first category are those people who are willing to make a quit attempt. So you can also assess prior quit efforts to personalize the treatment. You can also assess whether they have used any medications before, whether they have had help, professional help, and whether they need to be referred for psychosocial support. There's also another group, after you assess their willingness, are those people who are not willing to quit. So you must use motivational interviewing technique, for example, to assess the barriers or the roadblocks for quitting attempt. So you can talk about the relevance of quitting, the roadblocks, the rewards of quitting, okay? And keep on repeating this every time you see the patient or at every opportunity possible. You can also assess their motivation under this assessment, so that people who are highly motivated would receive your intervention as soon as possible. Having said that, it's not always necessary to only help motivated smokers. Some patients may, at the point of the first encounter, are not motivated to quit, but upon you continuing or to offer assistance, they then make the decision to quit attempt. Because hidayah is from Allah subhanahu wa ta'ala, so we hope for the best that our intervention would help them to make the decision to quit. If they have made the decision to quit, then it comes the most how do I say, intense part, which is the assist. because this is where we want to incorporate both pharmacological and behavior intervention as necessary and as appropriate in order to make a quit attempt successful. So I will dwell a bit more about assisting later on as part of the certification program. The last A stands for arrange for follow-up, because we need to be in contact with the smoker once they have set their quit date, so that after the quit date, we would see them every week for the first month, and then bi-weekly for the next 2 months, and then every month to complete at least 6 months. We need to follow them up for 6 months to ensure that they are abstinent in order to have a 6-month smoke-free period before they are declared as a successful quitter. If they did not manage to quit within the 6 months, we still can continue helping them. We arrange for follow-up, and then we try to help them at every encounter. Okay. The training program that incorporates the 5 A's that covered at least 6 core competencies that include counseling skills. We know that pharmacists have excellent medication counseling skills, but for smoking cessation, it extends to more than medication counseling. So it dwells into, for example, as I mentioned just now, the motivational interviewing technique, so that there will be a collaborative relationship based on trust, and also facilitate client involvement in treatment and commitment to change. Because we are assessing some what people consider as taboo or sensitive topic, which also relates to substance abuse, maybe alcohol abuse, maybe other types of substance disorder, including gambling disorder and whatnot. So the assessment may be a little bit sensitive, and therefore there should be a way that the counseling is done in the private setting, and then the client or the patient is made known beforehand by saying, for example, that all the information shared during the counseling session will be kept confidential and only used for the purpose of treatment. Okay, because you need to obtain comprehensive and accurate data in order to plan the best treatment and hoping for the best outcome. Because once you go into treatment planning, you have to be able to develop an individualized treatment plan using evidence-based treatment strategies. This is when the clinical practice guidelines would come into place, and also the fact that we know not two smokers are alike. They have differences, even though they may be smoking the same number of cigarettes per day, the same brand and whatnot, but certain smokers, they smoke because of stress. Some smokers smoke because of other factors, for example, when they are bored. So we need to identify what are the triggers, what are the factors that promote smoking, and what are the coping mechanisms that the patient would be able to do in order to have the best treatment plan for the patient. Pharmacotherapy. Okay, this is again the expertise of pharmacists, because we need to provide clear and accurate information about options available and their therapeutic use, as well as monitoring. So in order to select the most appropriate agent or agents, meaning that you can use combination of the smoking cessation products, you need to be able to know about the products and also provide accurate information to the patient. Because ultimately, what you suggested may not be suitable for the patient, so you need to consider not only the safety, efficacy, but also suitability and also cost, if you're talking about out-of-pocket in the community pharmacy setting. Knowing that tobacco use disorder is a chronic relapsing addictive disease, so relapse prevention is crucial. So we need to offer methods to reduce relapse and also provide ongoing support for tobacco dependent people. Last but not least, which is a huge challenge, is documentation and evaluation, because we need to describe and use methods to track individual progress, part of record keeping, program documentation, outcome measurement, and also reporting, because at the end of the day, people would ask about return on investment, And if you are working for somebody else in a community pharmacy, for example, the owner of the pharmacy or even yourself would like to know that the time that you have spent or um, uh, spent on the patient for counseling and also the medication that you have sold are going to be not just profitable on one sense, but also going to produce the quit rate that you would like to have. Okay, so these are some of the pictures that way back when, about 15 to 20 years ago, when we started the certification program called the Certified Smoking Cessation Service Provider. You can see here in one of the pictures that this is taken January 2005. So earlier workshops were done in a face-to-face, big kind of lecture hall, theater style and whatnot. And they will be also incorporating role play because we want the pharmacists. Yes, these are majority pharmacists, but we also have health professionals from the medical fraternity, from the nursing and dental fraternity also join us for the certification. So for example, this particular picture showed that they are having a role play, and what they're doing is to identify the stage of behavior change using the trans-theoretical model of behavior change by Prochaska and Clemente. So for example, if someone is given a scenario where the patient is in pre-contemplation or contemplation, so what would be your response versus someone who's in preparation or in action? After the one-day workshop, the participants would then be attached to a one-day activity at any of the Ministry of Health run quit smoking clinic or any of the community pharmacy where the person assisting or person that are working there is already a certified smoking cessation service provider. So meaning that the certification program has two parts. One is the didactic part and the other one is the experiential learning. In this case, attachment. For example, you can see a picture here whereby this is an actual client and this is me assisting the smoker and observed by someone who wants to be certified, meaning that the person would have to go through the checklist as on the left side of the slide, would see how we intervene and provide the service from the introduction to thanking the patient using lay language throughout the session. So the person will actually first observe and then later would be assisting under observation. So upon completion of the one-day workshop for the knowledge and then the one-day attachment for the skills and additional knowledge, and the person would be fully certified as a smoking cessation service provider. Realizing that we need to expand the reach and use the internet particularly for provision of knowledge. So under the Academy, Malaysian Academy of Pharmacy or MAP, we then converted the didactic part into the online module. So this module actually recognized by the Ministry of Health would then require the person to undergo the module and take quizzes to pass the whole module. Okay, the module incorporates, as I've said, the evidence-based and also latest information regarding the tobacco control, for example, from the WHO Framework Convention on Tobacco Control, or the FCTC, which is the International Public Health Treaty on Tobacco Control, and also the Empower strategy, which is monitor, protect, offer, warn, and enforce, and also raising tax. Plus the National Tobacco Control Strategic Plan, and also the law and regulation concerning tobacco in Malaysia. As I've said, the clinical practice guidelines provide the evidence-based information for intervention. So I was lucky to be the chairperson of the National Clinical Practice Guidelines on Treatment of Tobacco Use Disorder 2016. And as you can see, the content there, There's clinical intervention for all smokers, for patient unwilling to quit, patient recently quit, and also for special populations. Okay, so the online module, as I've said, would assess the knowledge. So it has 6 chapters in, in numbers. So after each chapter, the person would have to attempt the quiz, and they have to pass 80%. Yeah, because it's a very easy module. Because you just read the module and then answer the quiz. So you can attempt it several times and then until you pass. Okay. So once you pass the module, you can provide your input before getting your e-certificate. So far, Alhamdulillah, the feedback has been positive. And some of the comments, they suggested to have some pamphlets and some other materials which we look into, and then we improve the module from time to time. So after the online session, we still need to assess their skills. So some of you may be familiar with objective structured clinical examination. So we do similar things when we have a simulated patient, a case scenario, and then we have an assessor. And we do this in order to ensure that the participants get a different flavor of cases and able to pass in order to be fully certified. Okay, so this is another option. So as you can see, the earlier option is that you can go through the face-to-face and then attachment, but an alternative pathway is to do it online and then go for OSCE. Okay, and Alhamdulillah, the Malaysian Academy of Pharmacy has been identified as one of the partners for the Ministry of Health MQuit services. So this is a partnership between the public and the private sector in order to boost tobacco control, particularly delivery of smoking cessation intervention in Malaysia. So our training program actually has been identified and accepted by the Ministry of Health as one of the pathways to certify healthcare professionals for MQuit registration. So we call it the level 1 if they have passed the online services, courses, and then level 2 if they do a one-day attachment, or alternatively they can take the OSCE. And then after that, they will receive the certificate, which will then be used for registration for the MQuit service, pending the audit of their premise. So that's one more step before they are fully registered under the MQuit service by under the Ministry of Health. So they have to go and audit, whereby the personnel from the state health would go and visit their premise to ensure that they have the proper setup, they have a counseling area, they have the documentation systems, they have the medications, they have the references, and so forth. So once they are finished, they can be listed as a MQuit provider. This is the audit form. So they will get a plug. For example, this is an actual pharmacy during the launching of the MQuit service. So people can see that, yes, this is a certified pharmacist, and people can get the quit smoking service from the place. Similarly, they can also be listed online, and people can browse through the website and pick and choose the community pharmacy nearby to them, in which they will be able to go and obtain medication and also counseling. So we know that we need to increase the delivery of the service in order to get higher cessation rate to reach the target quit rate. Okay, and I'm happy to report that majority of the pharmacy under MQuit are actually actively providing the service. And we have so far more than 1,000 number of CSCSP pharmacists from the starting of the program. Okay, and now we have moved on to offering the training online, and we just had one with pharmacists from the Philippines. Okay, So this, we realize there are still challenges. So for example, reimbursement of the smoking cessation service, documentation always an issue, sharing of data, accessibility, and we hope that we can overcome this with time towards our future of having tobacco treatment specialists. So these are the references. Thank you so much for your attention.
Thank you so much, Dr. Haniki, for this great information. We have a question that we have a lot of data seen in your presentation that you have made a lot of cessation from smoking. Have you ever done like this that if someone is going towards smoking and before he get addicted to smoking, you have stopped from going through it so that cessation is not required?
So cessation is not required.
Before going to the smoking, you have stopped someone. Is there any?
Oh, prevention.
Yes.
Yeah, prevention, we do on, that's an excellent question. Of course, prevention is better than cure. So what we do is that we have school-based program. So this certified pharmacists would then be invited to join our school-based programs when we target certain schools and we do programs, activities, talking about, well, very little talking, is more on activities to elicit awareness and knowledge regarding harmful effect of smoking and also electronic cigarettes. And then this is done in the interactive manner, so that we hope that when they have the knowledge, they would not pick up smoking. So we target schools, actually, because we know in Malaysia the average age of starting is around 13 to 15. So we target this age group of students. Unfortunately, we cannot reach all schools, but we have targeted the high-risk schools as well as high-risk communities, because there are also those children or adolescents who are non-school going, and they are definitely at high risk of risky behavior, including smoking. So yes, to answer your question, we do some preventive programs as well.
Okay. Thank you so much. Just one more question, please. The certificate program that you are providing is just only for the pharmacists who have completed their graduation, or is it for the student as well who are doing their PharmD?
Okay, another excellent question. So far, because they need a license to practice, because the certification is towards the registration under the MQuIT registrar. So to be listed, you need to have a license as a pharmacist. So the certified pharmacists are graduate pharmacists. They are not students still in the university. They must have license
Okay.
to
Can you
practice.
share? Okay. Thank you.
Mm.
Can you share some experience in which the patient was very resistant for cessation?
Resistant.
Yeah.
Oh yes, many of the patients they exhibit resistance, and they can be as simple as not showing interest, or they are deflecting the topic, or they straight out denying the fact that they are smoking. So when you have someone resisting, you go back to the 5 A's as I mentioned just now. So it would be talking about the the roadblocks, why they don't want to quit, the relevance of quitting, the rewards of quitting, and also we need to repeat this every time we see them, because they come to us for multiple illnesses. You know, smoking is associated with more than 20 diseases, other than the common colds, respiratory symptoms, but they can be more severe than that. So whenever we see them, we try to repeat this so that they would have some insights to the fact that their disease that they are coming to us for is actually associated with smoking. So even if they resist, we must not be judgmental or confrontational. We still use the motivational interviewing technique. It's a very calm, it's a very how do I say, non-aggressive kind of like interviewing. So it's very relaxed. So we're talking about, okay, why do you think that you don't want to quit smoking? Are there issues that make you want to continue smoking? Have you tried quitting before and then you had a bad experience or things like that? So usually people resist because they either do not know or they resist because they have some misinformation. So the role of the pharmacist is to correct this information in a very, as I said, non-judgmental and non-confrontational manner.